The topic for today is multiple sclerosis and chronic fatigue. When we are diagnosed with MS, most people suffer with debilitating fatigue, not just I stayed up too late last night, but it's debilitating where you are so tired, so exhausted, you could sleep on the floor. You sometimes feel, a lot of people have shared, they just can't even take a few steps to the bathroom. It's really brutal and it takes over our life. The exciting news is that there is a lot of evidence that is pointing towards the parasites that I talk about, that I teach about, that are causing the MS, how they are causing the chronic fatigue that we suffer with when we have MS or other diseases, and how we can resolve this pretty quickly. If we haven't met, my name is Pam Bartha, and I'm the author of Become a Wellness Champion and the founder of Live Disease Free. I was diagnosed with multiple sclerosis over 30 years ago. And when I was first diagnosed, I had debilitating fatigue. I was literally flatlined on the couch. And many of you guys can relate to that. Please share and comment what your experience has been if you've been diagnosed with MS or if you've had it for a few years. And the fatigue can be so horrible that we just cannot function in life, where people say, I'm barely able to go to work, and when I get home, I just crawl into bed right away. Our social life gets impacted tremendously. We don't spend time with the people that we love because we just have to go to bed and rest. And so there are several different ways that parasites cause fatigue. And it's really our body's response. So it's causing our body to become deficient in different nutrients and impacting different parts of our body. But at the end, I'm going to share some incredible research that I just came across, and I'm going to go deeper into this in future videos too, about how, and I knew this, but just I didn't realize that there was such great research showing this, but how our immune system, how our immune responds to these parasites, how that is a huge contributor to the fatigue that we're dealing with. So what I'd love for you to do, because we are talking about new research, I should say it's current research, but unfortunately, like doctors have known 30 years ago that MS is caused by different parasites, but it's finally starting to come around. There's more interest. But unfortunately, all this interest is really to say, well, okay, so our body is producing certain molecules like chemokines and cytokines. We're not going to get too technical here, but just a couple of words. But so let's figure out how we can adjust the immune response when all of us that are dealing with these parasites were like, no, our immune system is great. Let's just deal with the parasites. So fatigue, like we all have fatigue if we're healthy, if we stay up too late. We're not talking about that kind of fatigue. We're talking about the debilitating, overwhelming fatigue that it just takes over and we have a really hard time functioning in our life. So it's not normal, and it's not something that you can sleep off. And it's true that when we have MS or other chronic diseases, we definitely will have insomnia. We might have a hard time falling asleep. We might wake up throughout the night. So we may be sleep deprived, and that definitely adds to the fatigue, and we have to address that. We also may have thyroid issues, which are really common when we have leaky gut, and all of us that were diagnosed with MS or other chronic diseases pretty much all have leaky gut. So these parasites, they start off in the intestines and they end up causing a lot of inflammation and a breakdown of the integrity of the intestinal lining. And then these microbes start to move into our blood and into our organs, but also larger pieces of food and different things that should not go into our bloodstream will go in, and we end up with leaky gut. And low thyroid is really linked with leaky gut, with gut issues. And as people heal their gut, then their Hashimoto's, their low thyroid, all of that totally will resolve. Also bringing in lots of nutrition too, right? So to support the thyroid. So we want to make sure that our food isn't deficient in iodine, etc. So those are two different ways that these parasites can indirectly. They also rob different nutrients from us. So for example, iron. So a lot of people with parasites, but also a lot of people with chronic disease as I have been coaching in the Live Disease Free Academy, they are anemic. And there's various ways. Number one, the parasites are freeloaders, so they will definitely compete with us and steal nutrients from the food that we take in. And then things like babesia, so worms, for example, they will eat our nutrients. And they will also produce enzymes that will cause us to lose blood through the stool. So we can lose a larger amount. So it's not just them competing with us for our nutrition, but it's also them causing blood loss through the stool. And that's really common. Some of the different types of worms that would do that would be hookworms and whipworms and flukes. They all would definitely be involved in anemia in chronic disease. And then what's really common in people that are diagnosed with MS or living with MS is that they are infected with different types of single-cell protists. One of them would be babesia, and that is one that infects and destroys our red blood cells. And so you can imagine that that is going to be definitely causing, it's called hemolytic anemia. We know Candida, which is a type of fungus. So I'm just doing like a light touch on different microbes, but there's many of them that iron is something that they all need for cell growth and cell survival. So Candida really makes us become deficient in iron. Also, there's studies that have been linked, especially if people have oral Candida or thrush. And so we talked about the low thyroid, but I also wanted to talk about insomnia, because the parasites, they're very active at night. And we know this from our students. I know this from my past history too, where we wake up throughout the night, or maybe we have a hard time falling asleep. So then if we are sleep deprived, then we're definitely going to be more fatigued. So things like the insomnia, where we become sleep deprived, and low thyroid. And then also, as I mentioned, let me just go back here. I just want to make sure I don't miss anything. Yeah, so the anemia and insomnia and low thyroid for sure. So I wanted to go on to the exciting part, is to really understand the immune response in MS and how that is really causing the fatigue, and what is our immune system responding to. That is the whole premise. So if we follow standard of care, they don't know, they think it's an autoimmune disease, MS. They think our immune system is attacking itself, and there is no known cause or cure. But when we think logically and we think about how our immune system is our natural defense against infections, and we know that different immune cells will go after different types of microbes, and we know that inflammation is always present in multiple sclerosis, and inflammation is our immune system's response to the infections, to the parasites. So our immune system sometimes has to go to war, and that is what inflammation is. It's the war. And so it's not just immune cells, but it's these little molecules too that are released, which are, again, chemokines and cytokines. And they all have different, they're basically like giving different parts of our immune system signals. So they work, it's so incredibly complex, and we're not going to go into the deep biology of it. We're going to literally just talk about one type of cytokine, just touch on it. But this is something that really definitely needs more discussion about, because we need to get our more and more practitioners and integrated practitioners and standard of care practitioners and researchers interested in not just trying to figure out, okay, which immune cells are active in MS and which immune molecules like cytokines, etc., are increased, but why are they? Like, what infections are causing this war, causing this immune response? Our defense is going after infection. Which infections are most common? We'll talk more about that later, but it's very important to just kind of set the stage to understand inflammation is the immune system's reaction to something foreign, and so it's usually infection. And we talked about, so we're going to talk about interleukin 6. That is one type of cytokine. I'm not going to talk about a lot of different ones, so we're going to keep it really simple. So I'll call it IL-6, and it is a molecule that our immune system releases. I'm going to talk about it because it's really relevant to multiple sclerosis. So it is a cytokine that our immune system releases as it is dealing with invaders, and it's setting up this plan of attack, getting the whole immune system involved. And so the IL-6 is released. It's produced by different types of cells. So it's produced by macrophages, which are immune cells. They're kind of like Pac-Man. They destroy and they produce these cytokines, but also cells that line they're called endothelial cells. So cells that line the surface of our body. So that would be like in our lungs and in our skin, etc., but also muscle cells. And interleukin 6, it's been studied as a possible, or it being involved in the cause of multiple sclerosis. So this is a 2020 study. It's very, very new. I'll just read out the title to you. I'm going to figure out a way to give you guys my notes. I'll probably post it on our website, and I'll definitely put a link in this video for it also. But it's a 2020 study, and it's called IL-6, so IL-6, in the cerebrospinal fluid, signals disease activity in multiple sclerosis. So it signals disease activity in multiple sclerosis. So remember that our immune system is our natural defense against infection. And when you start to look at all of this, it just drives you crazy because it makes so much sense. And why are we not treating infection in MS? So in this study, it's a really great study. There's a lot of rich information in there, but they share that IL-6 is more often detected in the central or the cerebrospinal fluid of MS patients compared to controls, compared to people that don't have MS. IL-6 is equally present in the cerebrospinal fluid, so in the spinal fluid of all types of MS. So that could be somebody who's just had one attack, so that's the clinically isolated, or it could be a syndrome, or it could be relapsing remitting, or it could be secondary progressive or primary progressive. So it is equally present in the spinal fluid of all types of MS, but not in people that don't have MS. And they talk about other studies. Within the study, they're comparing their research to others where other studies, one of them found so IL-6 in the blood serum and the tissues of people that were suffering with rheumatoid arthritis and lupus and multiple sclerosis. IL-6 is released from monocytes in MS patients. And we know that monocytes release this cytokine when in response to specific molecules that are produced by different types of microbes, by different types of parasites. So when there are different microbes in our body that shouldn't be there, they're producing these little molecules, toxins, you want to call them, and our macrophages see that or sense it, and they produce this IL-6, getting the immune system involved, like calling in the troops, right? That's basically what it's doing. So in this current study, the 2020 study that I just shared with you, they also found higher amounts of these other pro-inflammatory cytokines in the spinal fluid of MS patients. So again, I'm not talking about the whole immune response. We're just talking about one type of cytokine. Maybe you guys have heard of cytokine storms. Basically, it's like a real strong immune reaction to some foreign invader in our body. And so there are different types of cytokines that would be involved when we have infection. I'm just talking about IL-6, but they also found higher amounts of other pro-inflammatory molecules in the spinal fluid of MS patients when they were dealing with acute flares, when they were having an MS attack. So IL-6, but also IL-1 beta and chemokines, which is CCL5. So those are just, if you don't understand biology, it doesn't matter, but just understand that the body is amazing. And instead of thinking like our immune system has gone awry, we have to shut it down, we have to modulate it. No, we have to figure out what is triggering it to go on the attack. Let's support it, because we've been dealing with these parasites for years and years, and there gets to be a point where our immune system is really struggling. And that's been our experience for myself, but also for the wellness champions in recovering from MS. So really, really fascinating. There's a ton of great information in that. And if you don't understand, I'm just trying to simplify it if you don't understand science a lot. But they also found increased IL-6, so that interleukin-6 was found in both acute and chronic active demyelinating lesions. So in active or dormant lesions, the demyelinating lesions, they found the interleukin-6 present there. And it's been suggested by researchers that the pro-inflammatory cytokine storm is crucial for starting and maintaining the inflammatory immune response in MS. So it's all really, really important to understand that this is part of it. And this is more evidence showing that there is some kind of infection going on in that area, because our immune system produces these in response to infection or trauma. So obviously we haven't, hit our head on the ground, or that's not what MS is about. We haven't fallen off our bike and scratched our knee. That's inflammation too. But inflammation inside our body is caused by the infections, or it could have been some poisoning, but that again is not the case for most of us. Like if we were exposed to some horrible, horrible poison, but in MS, it's infection. Increased they also found, so increased the IL-6 in the spinal fluid of MS patients, so that's a different one, was associated with higher disease activity and increased risk of becoming I think that is IL-6. I'll have to double check. I think I did it. My computer did a little spell check thing there. So they also found higher interleukin levels in relapsing remitting patients that were associated with higher disease activity and increased risk of becoming progressive. And for over 80% of people that start off relapsing remitting, we end up being progressive in time. They also found increased, that would have been, 6. So increased spinal fluid interleukin-6, so IL-6 levels at the time of being diagnosed with multiple sclerosis was associated with higher numbers of relapses and increased disability in relapsing remitting. During that, they followed that for 3 years. So they found that the higher the amount of this IL-6 when we're diagnosed, it's associated with more attacks, more MS attacks, and increased disability if we're diagnosed with relapsing remitting. And that was in a study that they followed people for 3 years. So this article, I think I'm going to give it a little bit more justice in another video, because it's really huge. It's really helping us to see, it's more evidence that, because we know that the cytokine storms and cytokines are produced, they're pro-inflammatory. We know inflammation is caused by infection. And so all of this is present, like in the lesions in that area, in the spinal fluid. And that is so much evidence that MS is, again, more evidence that it is a parasitic infestation. So how does this relate to fatigue? Well, we know that when these cytokines are produced and the immune system is activated, that one of the main symptoms is fatigue. So when our immune system is going on the attack to try to deal with the infection that's making us sick, one of the main symptoms is fatigue. Flatlined on the couch. That's how I was when I was first diagnosed with MS. So then what can we do? Like, obviously, if we go work with standard of care, they don't believe this. They don't believe infection is a problem. So what can we do to help to settle down this cytokine storm, to support our immune system, to start to have some symptom relief and to start to have more energy back again? So what we have found is that when you, number one, start with decreasing the food to those infections that are making us sick, we notice that there is a huge improvement in energy. So parasites, whether they're fungi, whether they're worms, whether they're bacteria, they all thrive on carbohydrates and sugars. So as we decrease those carbohydrates and sugars, the parasites are less active. They're producing less of those molecules, right, that cause our macrophages to produce these cytokines, the IL-6 and others. And so we start to notice that the inflammation starts to go down. The war is not as strong, and we start to have really significant symptom improvements. Very, very important. That's the first step. That is the most important first step that we can do, is we can start to decrease this war by just not feeding the enemy so much. And again, then they're not producing as many toxins, and then our immune system is not going to react as strongly. That is a golden nugget. So we notice that within a week to 2 weeks, people, by decreasing their carbs enough, they notice significant symptom improvements in all kinds of things, including more energy. That's the first step. The second step is we support the body. So we make sure that we're having daily bowel movements, we're opening up our detox pathways. These are all steps we do in the Live Disease-Free Academy. We make sure we're having enough nutrition, we're getting enough sleep. So all those things I mentioned at the start that are important too, and they are present in people that have MS. We could have low thyroid, we could have terrible insomnia. So those things are really important to address. So making sure we're having daily bowel movements, making sure we're sleeping at least 8 hours at night, making sure that if we have anemia, so we have low blood iron, that we address it so that we build up our hemoglobin and our ferritin, and low thyroid, if we have low thyroid, to make sure we support the thyroid so that we are able to have, so all those things help, right? They help us to feel better. But it's really when we start treating, that is where we notice people get their energy back totally, which is so exciting. So I'm just going to go to your questions here, see if you guys have any questions for me. Hello, Alexander. So fatigue is definitely, yeah, share with me how significant fatigue has been for you with your diagnosis. There is a small number of people that don't have debilitating fatigue, but most people with MS have it, and they usually have it while they're having an MS attack. So Maureen, fatigue was definitely an ongoing issue for you. Heat makes it worse also. And you wake up, especially at night. That is something that's very common. The parasites, they're very active at night. They produce more poison. Some of the poisons, our liver works hard during the night trying to detoxify those poisons, but sometimes it can't keep up. And one doctor explained well that if it can't keep up, those toxins cross the blood-brain barrier, and then we end up waking up. And as we treat the parasites, then we definitely don't have those issues anymore. Hello, hello. Have you ruled out Lyme? Roxanne, the Lyme infections are part of the cause of MS. So again, the fatigue is the biggest part of the fatigue. So the anemia, the low thyroid, the insomnia, all of those things definitely make us more tired. But it is our immune system's response to different infections. And when we have MS or other neurological diseases, then the Lyme infections are usually part of the problem. So what we've seen in our students is that they have large worms, they have small worms, they have worms all the way into the central nervous system, as was shown by Dr. Alan McDonald. They have protozoa, which are single-celled parasites, so they can have Giardia, they can have Babesia, Babesia is one of the Lyme infections. It kind of travels. They can have different bacteria, so Borrelia, and there's Bartonella, there's all kinds of different microbes, on and on. So it will take forever to try to figure out which microbes are out of balance, because there are literally hundreds of thousands. There's at least a couple 100,000 worms, for example. And then even when you're looking at Candida or molds like Aspergillus, there's hundreds of species. So I don't think it's wise for us to try to figure out exactly which one, because it's more than one microbe. So what we're doing is we are the steps in the academy is number one, stop feeding the infections. We find we have a lot more energy. We find that we feel a lot better. We're sleeping better. We have better mood. Some people have improvements with neurological symptoms like spasticity. They're able to walk better, more strength just from the diet. Then we support the body, and that is the prep phase, and we're getting ready to treat. And then when we're treating, we normally will treat, if the students are testing well for worm and parasite drugs for protozoa, which are single cell parasites and worms, they'll treat those first because they're bigger. And then they will knock back fungus for about 10 days, and then they'll take a break, and then they'll cycle through. And if they have Lyme, they usually won't go after the Lyme infections until they're feeling a lot better, because a lot of people that they think that it's Lyme disease, they may have had a positive test and they've treated with Lyme later doctor, they've been on antibiotics for months and they're feeling horrible. It's parasites. So if you focus on the parasites first, knock them back tremendously, then circle back around. And if you need to treat the Lyme with maybe some liposomal herbs, it's a lot easier then. But yes, the Lyme infections are definitely part of the problem with pretty much all of the students that I've worked with. Hi, Sheila. Hi, Daryl. Anyone else have a question for me? Joanne, losing control of your legs and arms. I'm so sorry. You have to treat the parasitic infestation. If you're new, some of you this is the first time you've met me, make sure to go to YouTube, Live Disease Free, and you will be able to see that I have a playlist for the types of infections that we're dealing with when we have MS and chronic disease. So it's not just MS, but start to learn about the infections, start to change your diet, start to feel better, get ready to treat. I've got some exciting things coming up here pretty quick where we are going to be doing like a challenge. You'll hear more about it within the next week or so to get you guys started on things. Hi, Madeline. What about squash? It's very low in carb, very low in sugar. We personally, the only squash that we would have is zucchini and just small amounts. And it's really about keeping the total grams of carbs below 50, but the better spot is between 35 to 40. And some people find that around 30 is even better. So if you have squash, you'll see that your carbs are going to get up there really fast. And then you'll be like, oh my gosh, I can't eat anything else today. And it's not just in the day that you keep the total grams, it's with a meal. So that's why we eat a lot of leafy greens for the majority of what we're eating. And we do include things like broccoli and asparagus. There's a lot of vegetables that we can eat. But squash will be too high. It will make you go over, and then you're not going to notice any symptom improvement. These microbes are so tiny, they don't need a lot of food. And so the squash, we cut that out because we find it's really hard to keep down between 35 and 40 total grams of carbs. That includes fiber, sugar, and carbohydrates. So the only way to do that is to just make sure we're not having, so for example, like we might have a little bit of avocado, but it might be 2 small slices on a very large salad. We're not even having half an avocado in a day. Things like carrots and peppers, we would have just a garnish. So those things are garnishes. They're too high in carbs and sugar. So, squash isn't that great on a salad, but that would be like as a garnish kind of thing. But zucchini, just small amounts of it, not making a whole plate full of zucchini noodles, like trying to go for the spaghetti. You'll find that is going to push you over the edge with the carbs too. And it's the carbs that feed these parasites that make the inflammation stronger. And it's the inflammation, it's our immune system fighting those parasites that makes us so tired. Take me up on it. What I want you to do is to start. If you haven't started yet, cut out the sugar. That's the first thing. That is the gas on the fire. That's the most ideal food for these microbes. Cut out all the sugar. And you might have some withdrawals for a week, but I tell you, within a week's time, you're going to start to notice symptom improvement. And then as you are able to then get the dairy out, get all the gluten out. And then as we move into the Live Disease-Free diet, we're getting all the grains out and we're just doing vegetables and meat and fat. And you'll feel like a completely different person. You still have to treat. That's very important. You have to treat the parasites because if you eat the wrong foods, they're just active again. And then the inflammation comes back again, right? And also as we get older, they still live in us, they reproduce. You can slow it down by eating carbs, low carb, but the ideal is you want to decrease the burden, the parasitic infestation in your body so that you're out of the danger zone so that you can handle the stresses in life. So really, really important. Hi, Joanne, you're on a 14-day treatment for H. pylori. Didn't make much of a difference. So the H. pylori, like when we have a lot of inflammation, then we end up with decreased stomach acid. So if we're dealing with a chronically inflammatory state, which is MS or any chronic disease, then what's very, very common is that we have lower stomach acid, and then that is part of the consequence of living in a chronically inflamed state. And with lower stomach acid and aging too, that's another part of aging, but it's not a normal part of aging, but there will be a little less stomach acid. So when we have less stomach acid, then the microbes that we take in, they can live. Like normally our stomach acid should be so strong that it just kills any parasites that would come into our stomach. And if it's becoming less acidic, then different bacteria will grow. So that's kind of like the H. pylori. It can give us acid reflux. It can be uncomfortable. We can end up with GERD in time, more inflammation in the esophagus, can't swallow. Those are all secondary symptoms of the problem. And so that's why you didn't really notice a difference. And unfortunately, a lot of people with the stomach acid, or sorry, the reflux, they are prescribed medication to block the stomach acid further. They think, well, you've got this acid reflux, you've got too much acid in your stomach, so we're just going to block it. And that makes the situation worse, and it makes people very, very sick in time. So that's not the answer. The answer is actually to stop feeding the infections, to actually sometimes supplement the stomach acid with betaine, HCl from the health food store. Again, everything I'm sharing is for educational purposes. I don't know anything about you, but that's what I do in the academy is I help coach people so that they're taking the right steps so that they're not making matters worse. So Joanne, your symptoms, that's secondary. And then just by treating the pylori, you might have a little bit of less stomach acid for a while, but it'll probably come back again because, the acid reflux or the discomfort there, because you've never dealt with the problem of decreasing inflammation, supporting stomach acid so that your digestion is improved, and treating the infection. So that's the order to do it. Hi, RL. Do you need to treat the whole family for parasites to prevent reinfection? That's a great question. I think that, and I don't know if you have pets or not, but it's really important to treat your pets regularly. But it's also important, like as you recover, you'll want to treat your whole family at least once a year. That is called prevention. So that is something that we have, it's a lost skill. When I was really young, growing up on a farm, our doctor would deworm the whole family. And that was like, I'm turning 60 this year. So that was a very long time ago. And this is a skill that's been lost. And why has it been lost? Because there's a lot more money in suppressing your immune system than there is in treating parasites. So in order to prevent chronic disease in your family, then like what our students are doing in the academy is they're learning this skill. They're understanding like which symptoms are suggesting that the parasites are becoming a little too populated in the body, and what kind of things can we do holistically to get ready and to really discourage them and then to treat them. So it is wise to treat your family at least once a year. And of course, different ages would be treated in different ways for sure. So Madeline, did you say that if you have a relapse, you are more likely not to heal from MS? No, I don't know what you mean by that. Did you say if you have a relapse, you are more likely not to heal from multiple sclerosis? No. What I'm saying is that the relapses are basically times when the infections are a little bit too active and the immune system is not able to deal with them. And then you have significant, like a very strong immune response. And the exciting thing is that if maybe you haven't seen a lot of my other videos, but we have students that have had MS for 25 years, haven't walked for more than 5 years, severe drop foot, and I've never promised that they can walk again, but they are starting to walk again. And do we have more improvement to treating the parasites? Like more to learn? Absolutely. But it's really exciting to see the possibilities of what people can do, how much recovery they can have. So if somebody is still walking right now, then there's no reason why they can't continue and have incredible improvements in their mobility. And for people that are in a wheelchair for a long period of time, I can't promise. But what we do is we do all the things we know we should do so that we see how much recovery the body can have. It's always a lot more than people thought. So the disease will stop. People are able to come off their medications. They feel a ton better, and they have more recovery than they thought possible if they're severely disabled. And as I'm saying, and we have the wellness champions, which are really dedicated, driven people. So they're implementing really well, treating. But it may take somebody who's quite disabled, it might take them 12 to 18 months to treat, to decrease the parasites well enough. Because as I mentioned on this talk, that remember the interleukin-6 was released from some of the lesions in the central nervous system too. So it's all the way into the central nervous system. And some of these parasite drugs, they don't penetrate the central nervous system as well. So that's why we're using, in the Live Disease Free Academy, we're using like strategy and layering of therapies. And that is really where the magic is happening. Hi, Elaine. You wake up as tired as when you went to bed. It is the parasites. You need to treat them. Hi, Random Guy 21. So if you want to be in touch, then I will post my masterclass training. And that is basically, let me backtrack for a minute. If this is the first time you've met me, then make sure to watch some of my videos and like just build up a belief of what I'm talking about. I've got a ton of videos on all kinds of research and lots of worm pictures of what my students are passing. A playlist. So on YouTube, Live Disease Free, learn about the eating plan, start to implement it, start feeling better, and learn about the infections and start to clean up your environment. But when you're at the place like, Pam, I get it. I know it's parasites. I believe you. I want to treat them as soon as possible. I need support. I need guidance. This is a whole new thing. Then watch my masterclass training, and I can support you in the academy. So the masterclass training really goes into more detail about the parasites. There's a lot of case studies. I go more into the steps in the academy. And if you're at the place where you would like to join the academy, then you'd fill out the form. Like you might have questions for me. You just want to talk to me about it. You fill out the form, and then you can book a time in my calendar. You'll get a link to that. So those are the different options that I can do to support you is through the videos. I've got probably 80 videos online that can help you, but they're in different playlists, so you can pick topics that you need. But it's just for people wherever you're at. Maybe this is new to you and you need to build up your belief about it. There's also a lot of success stories of people sharing their successes on YouTube and on our Facebook page, our website, livediseasefree.com. And on our website, you'll also see research. So if you want to see that there are studies that link MS with infections, with fungus, with Lyme disease, with worms, like incredible. There's a whole bunch of studies on our website, livediseasefree.com, under research. So you don't have to be science tech. You can just kind of scan. I've kind of summarized things, or look at the abstracts, which is a summary of different studies, to see that they've been finding. Dr. Alan McDonald has found small filarial worms in every MS patient he tested, in their spinal fluid, in their central nervous system. He's found Borrelia, which is the bacteria that causes Lyme disease. And then other studies have found Candida in not just the spinal fluid, not just the blood and the spinal fluid, but also in brain cells of MS patients. So, and then they've been finding these spirochetes, these corkscrew type bacteria like Lyme, Borrelia, since 1911. I think that was the first time that there was a study written about it. I've got that listed there on my website also, livediseasefree.com. So when we have chronic disease like ALS, PLS, MS, we're really out of balance. We have multiple infections that need to be addressed. And one of the devastating symptoms that we can have, which causes us to feel like we could just lay on the floor, we could sleep on the floor, we're so tired, can't function, just want to crawl into bed, is the fatigue. And that is a symptom of an immune system that is really working hard. And so, like this is that cytokine storm, the overreaction of the immune system, because it's an unfair fight. Our immune system is really struggling. And simple things, trust me, start the diet, watch my videos on YouTube, Live Disease Free on YouTube channel, start to implement it and you'll start to feel better. We also have the Live Disease Free community. And on that, you'll see under files, there is the cheat sheet, which says what you should eat and what you should avoid. You can print that off, put that in your kitchen. And again, I mentioned we're going to have a challenge coming up here within the next, I'd say, 2 weeks or so. So make sure you watch out for that. And that'll help you guys to get started too. Otherwise, let's see if there are any other questions. So optic neuritis, Monica, you're asking about optic neuritis. Yes, it depends how long ago you've had it, but I do have a video on optic neuritis. So for myself, I had it 30 years ago and I had a severe case and I haven't been able to get any improvement, but I have lots of students that have had a lot of eye issues and optic neuritis. It really depends how much is still inflammation and how much is permanent damage to the myelin sheath, to the optic nerve, pardon me, the optic nerve. So, but check out the video, YouTube, Live Disease Free, about optic neuritis. Teresa, do you treat parasites with a naturopath? No, my students, it depends. So most naturopaths, they cannot write prescriptions. So our students will do a lot of the work themselves. They might use a naturopath for energy testing to see which of the treatments work best for them, but they really do a lot of the work themselves. It's a lot more cost effective that way. And then you have that skill for life. But you would probably need a prescription if you're working with a doctor, like to get the other parasite drugs. Hi, Rob. Can you repair the myelin sheath? If it is still inflamed, so that is like an active, something that's active and it's not permanent scarring to the myelin sheath, that can heal. And so when people have had MS for 25 years, maybe they haven't walked for 5 or 10 years, it's assumed that that is all permanent damage to the myelin, permanent scarring to the myelin sheath. Scar tissue cannot be healed at this time. But the exciting thing is that there is so much that is still in the inflammatory state. How do I know that? Because people are starting to walk again after not walking for many years. So that is really exciting. I can never make promises. I don't know who is and who isn't. And I know that we're going to get better and better at treating these parasites in time. That is what the focus of what we're doing through the academy, but also through the new group, the MSIDI, getting different research and protocols and testing. So the body repairs the myelin sheath, Rob. It's not us. And if it's still in the inflammatory state, the body can repair it. If it's scar tissue, then at this point, it can't be repaired. And we don't know. We don't have good enough tools to measure that. Hi, Frida. You need the challenge. So I'll definitely let you guys know when it's starting. You can't wait to hear about it. Well, I'm excited to share it with you. Thank you, Aurora. Coffee is okay. Good question, Madeline. So coffee, anything that has caffeine in it, if it stimulates you, what is it going to do to the parasites? It's going to stimulate them too. And the more they're stimulated, the more toxins they produce, the more inflammation we have. So no, we don't do any caffeine, and not even decaffeinated. Because remember, these parasites, some of them are not visible with a naked eye, so they don't need a lot of caffeine. They don't need a lot of sugar. We cut out all the caffeine for sure. And no, go to herbal teas. There's beautiful herb teas. And yes, it takes a little bit to adjust your taste buds, but it's worth it. You'll find as you treat these parasites, you'll find you have energy all day long. You're not going to have the slumps. I haven't had coffee for years and caffeine for years, and I probably couldn't handle it because I'm already quite active and very energetic. So absolutely no caffeine of any sort. And of course, no milk and no sugar. So there are things like there's different rooibos teas. Just make sure the tea is not sweet, but there's chamomile, there's peppermint, there's really great one from Celestial Seasonings. It's called Vanilla Sleepy Time. There's another company called Tega, Tega, which makes like a rooibos, but also another tea that tastes like Earl Grey. It's really good. So there are so many different teas that are great that are not going to activate those parasites or influence them in any way, but it'll definitely be tasty for you. Catherine, what point with Dr. Terry was, yeah, so Catherine, she did amazing. So Dr. Terry Walls, I have a lot of respect for her. And just with diet and supplements, she's been able to manage it really, really well. But if you listen to her, she does say that there are times that she gets excruciating nerve pain. And so she still has to take medication. So she hasn't treated the parasites yet. And I really hope and pray that in the future, near future, that we are going to be able to collaborate together. That I guess the problem is that there has been some research coming out saying that parasites are actually good to have and they modulate the immune system. And all I can say is we've had over 700 students in the academy, and they have passed so many different big worms, and every time they pass them, they feel so much better. So that research is kind of like a decoy getting us off track with what we really should be doing. And so Dr. Terry Walls, the last I chatted with her, she felt that that was still really important, or not important, but it's promising. So that, giving people worms might modulate the immune system. It's like, no, we don't need them. And when you look at those studies, those people, they're like, get them out. I have such terrible gut problems from them. So no, they are not good. The more we deworm, the longer we live, according to Dr. Klinghardt, and I totally believe that. As you deworm yourself, you feel younger and younger and younger. The people that are in extended care facilities that are suffering terribly, that are very disabled, that are cognitively, they can't think, they can't talk, they are infested with parasites. The people that are 90 years old that are still driving, they still have their mind, they might be skiing, they're smart and sharp as a whip. They have a completely different set of microbes in their body than the people in the care homes. That's the difference. So that's the skill you need to learn, whether you work with me or whether you work with someone else, whether you work with the Live Disease Free System. It's just that we have a lot of experience. It's hard to find practitioners, and that's part of our job, is to help people find the practitioners that they need. And it's very, very minimal. You can do a lot of the work yourself. Hi, Frida. So interleukin-6 can affect people without an MS diagnosis. Yes, also autoimmune, different autoimmune disease. So the talk today, and I should have been more clear, it's not just MS. It's just that I work with, or I attract a lot of people that have MS because that is what I recovered from. But the interleukin-6 is present in people that have autoimmune disease also, absolutely. So when you have, let's see, what do you have? So you may be diagnosed with something, or you may not, Frida. Sometimes we are pre-autoimmune, and so we have different types of parasites, and our immune system is fighting them. And yes, interleukin-6, the IL-6, and different cytokines are produced. So that fatigue is really a response of an activated immune system. All right, your immune system is fighting, and it needs energy. So that's why you're feeling fatigued. Victoria. So Lyme led to MS. I've heard that several times. You're so underweight. Being underweight is caused by the parasites, for sure. So you had Lyme. Let's put it this way: you were diagnosed with Lyme. So maybe you did the Western blot, or there's different types of tests to be diagnosed with Lyme. But I can guarantee you, if I worked with you, Victoria, that you would see that you had parasites years before your diagnosis of Lyme. And that is, so when we're really out of balance with our microbes, then what happens is that our immune system is suppressed, and then the bacteria that, let's say we are bitten by a mosquito or a tick, it could be a mosquito too, and we're infected with the Lyme infections. Those are the people that can't clear, their immune system will not clear the Lyme because they're in a state of severe dysbiosis. They're really out of balance. They've got big and small parasites. They've got fungal overgrowth. Their immune system is taxed. They're bitten by a mosquito or a tick. They're infected with the Lyme infections. And then they're tested and it's like, oh, you have Lyme. We've got to treat that. But you're not dealing with that whole, the bottom part of the iceberg, the big part of why you had Lyme symptoms. Most of us have been exposed to the Lyme infections. Why is it that maybe 25% of us have Lyme disease when other people were exposed and they don't have Lyme disease? I know this very well. Some people that I know in my life, in my family, they're tested with, DNA tests, and they pick up Bartonella and Borrelia, 2 or 3 different Lyme infections, but they're asymptomatic. They don't have symptoms. So that is the key, is that we're always going to be exposed to, there's pretty hard not to get a mosquito bite, and a lot of the mosquitoes are infected. So instead of trying to just focus on the Lyme and trying to treat that, you'll have a lot more success by treating the bigger issue, which is the parasites, possibly fungus, and then the Lyme. And then you're going to be able to put weight on too. So if you're underweight right now, that is because of parasites. So we have students that are overweight, but a lot of them are underweight, and it's you need enough calories. So it's not the carbs, it's the calories. So as you decrease the carbs, you increase the calories from fat. So you're still eating 3 big meals a day. You're having a little bit of nuts and seeds, not much, because that can make you feel horrible because there are a lot of carbs in them also. But if you do that, you'll maintain your weight, get to treating right away, and then all of a sudden you'll be able to put weight on with healthy foods. Catherine, let's see, Rob. Okay, last couple of questions here. We've gone quite a while. So parasites affect arthritis in the neck and shoulders. Yes, absolutely they do. Thank you for your kind words, Aurora. You are very sweet. What about oxalates in vegetables? They're really hard on the immune system? No, they're not, because if they were really hard on the immune system, then everybody that eats spinach would be sick. If we are dealing, so if you have a lot of vegetables that have the oxalates or oxalic acid, then it's probably not the most health promoting thing to do. You want to definitely switch up your vegetables for sure. But honestly, like, our students are still having spinach, not every day, but they're just eating a variety of vegetables to get a variety of nutrients. And yes, if you, let's say, have thyroid issues, your thyroid is suffering because of the leaky gut, because of maybe nutritional deficiencies, not getting enough iodine, etc., then yes, it is important to just not have a huge amount of oxalates, but we don't do that. We eat a lot of different vegetables. So, Jackie, do parasites cause overweight? Yes, they certainly do. And actually, that would be a good topic for another time. Frida, you're very welcome. Thank you so much for your kind words. You've heard that COVID vaccines might affect some people in the future, predisposing them to autoimmune. That is a topic that I can't talk about here, Catherine. It's a very touchy topic, but I am going to be moving over and talking about those kind of things on a different platform. If any of you are just questioning, like, I just don't know if it's safe, I don't know if I should get it, then please just email us at info@livediseasefree.com, info@livediseasefree.com. We have an email that we send out then, and it has a lot of information from incredibly wise doctors, immunologists, virologists, epidemiologists, and very quickly you'll be able to make an informed decision for yourself as to whether you're going to have that or not. And I can tell you right now that 2 of my students have had it, and both of them have had very significant adverse effects from it. And we don't know how long those adverse effects will last. That's the problem. It's a new technology. So I can't talk about that on here because the censorship is unbelievable. And I don't want to risk all of the work that we put into this, into these different groups here. So, but just if you want information that you're not getting from the media, just go to info@livediseasefree.com, email info@livediseasefree.com, and we'll send you the email. And hopefully I won't give Caroline too much work. Okay, last couple of questions here. Rebecca. So granddaughter is normal all day until 11 at night, and at 11, terrible cramping, belly pain, cramping at belly button, legs become very weak, unable to walk. You've got to address the parasites for sure. That's what it is. Then she's normal again in the morning. So this is where I hope you're working with someone, Rebecca, because with kids, you want to make sure that, yes, low carb is fine, but you want to treat effectively enough. So there's things that you need to learn that we teach that you can definitely, that will help her, because the herbs are usually not going to be strong enough by themselves. So there are certain treatments that kids can use that are safe. I'm really sorry about that. That's just awful. How old is she? Granddaughter? I don't know. I'm so sorry, but it's awful that we have to suffer this way. How to repair the vagus nerve, the digestion can completely stop some days. So Madeline, again, we don't have to repair anything. Our body, we just have to support our body so it can repair itself. Like, our body is so incredibly complex. It is so amazing. It's designed so intelligently. We just have to stop the toxins. We have to help it. We have to decrease the enemy so that it doesn't have to fight so hard, and then it just repairs itself. And as far as constipation, that's a normal symptom. If that's what you're dealing with, it's a normal symptom of the parasites. It's not going to go away until you treat the parasites well enough. People have said, this is the first time in my life that I'm having normal bowel movements, and that is because they're treating the cause, which is the parasites. A big part of the parasites are in the intestines. So again, I'm going to let you guys go because there's more questions here, but we've been on for about an hour. So if you are new, start to implement the eating plan. Go to Live Disease Free YouTube. There is a playlist. There's a couple of videos there. There's a cheat sheet on the Live Disease Free community. Get rid of the sugar for starters. Absolutely. And the caffeine, you're going to have a headache when you get rid of it, but it's worth it. But just the sugar is number one. And then dairy, obviously, and gluten. Those are the 3 worst, right? And of course, alcohol is definitely something that you'd want to get rid of sooner than later. And if you're at the place where you're like, no, Pam, I've been doing all kinds of healthy things. I've already cleaned up my diet. I get the parasite thing. I've been watching some of your videos and I get it. And I want to treat, I need guidance, I need support. Then watch my masterclass training. I can help you in the Live Disease Free Academy. And I'm super excited to support you. We just had a bunch of new students join, and we have a brand new student from Indonesia. We've never had a student from Indonesia. So now we're in, I don't know how many countries. It's well over 15 countries, which is super exciting. So with that, I will be back next week, and I will have more information about the challenge. So take care and bye-bye for now.